fuels, addressing the human toll of climate change. This is a part of our COP28 webinar as we prepare ourselves to go to Dubai in November to December to cover this year's climate negotiations. I'm Diana Magbitang. I am Climate Tracker Asia's regional director, and I'm your moderator for this discussion. We aim to shed light to the detrimental consequences of burning fossil fuels and climate change and human health. So thank you for joining us today again. What we aim is for you to be able to have more story ideas for your application to our COP28 opportunity. We want you to engage with our network and also some experts that will be available for you today. Last week, we talked to our former fellows for you to be able to know how to ace your COP28 application. But today we'll also be joined by some of our former fellows who can share to you how they were able to basically write about the nexus of climate, health, and energy during their COP fellowship. So we are very, very excited. We have an esteemed panel of a panel of esteemed experts, advocates, and journalists that will share to you their insights and expertise on this topic. So for today's webinar, we're joined by Jit Suhal, who is the regional climate manager at Healthcare Without Harm, Sundil Dahiya, an analyst at Center for Research on Energy and Clean Air, or CREA. We are also joined by Lea Guerrero, country director at Greenpeace Philippines, and we are very proud to be joined by our former fellows, Hans Nicholas Jong from Indonesia and Nisha Wachpanich from Thailand. So our panel of advocates and experts will have 7 to 12 minutes to present their topic, and then we'll have a chat with our former fellows, and after that we'll have a Q&A. So please type your questions in our Q&A box if you have them, and we'll hopefully we'll have time to discuss them. So to get the discussion started, let's welcome Jit from Healthcare Without Harm, who will provide us with an overview of the links between climate change and health. Jit, the floor is yours.
Hi, Vienna. Thank you so much for the kind introduction. I'm gonna share my screen. And please let me know if you can see it. Is it okay now? Perfect. All right. Thank you so much, Vienna, again, and thank you to Climate Tracker Asia for the opportunity to be part of this very important topic. And I'm here to provide you with an overview of climate and health, the intersection between climate change and health, primarily. This is a really long topic, but I'm going to try to condense it to a couple of minutes as requested by Climate Tracker Asia. If you want to know more about this topic, we have a lot of opportunities within Healthcare Without Harm Southeast Asia, which I am an organization I'm affiliated with, and we'll be happy to provide more resources to you, and I'm going to drop them in the chat later on. So I want to start by just talking about and setting the scene on how the planet has warmed for the past few decades. We have seen steady, and actually not just steady, it's a sharp increase of global temperatures over the last few decades, approximately about 0.7 degrees Celsius between 1961 to the higher than our 1961 to 1990 baseline. And if you extend that to the 1850s, the average temperature rise would be around 1.1 degrees Celsius. And that's mainly because of human emissions of carbon dioxide and other greenhouse gases. And those are the main drivers of global warming that causes our climate to change. And out of the hottest years recorded globally, the warmest 80 years actually have all been since 2015. with 2016, 2019, and 2020 constituting the top three. But actually, just about 2 weeks ago, we saw the hottest global temperature ever recorded, according to the data from two climate tracking agencies from the US and the EU. And that was around, if I'm not mistaken, July 4, where the global temperature average reached about 17.8 degrees Celsius, when the previous record back in 2016 was 16.92. So it's not going to be the last time that we're going to experience really, really hot and temperatures globally. Um, and that's the reality that we face today. And that's all because of human activities. For more than a century, burning fossil fuels has generated most of our energy needs, required to propel our cars, power our businesses, our homes, keep the lights in our homes and our hospitals. And even today, coal, oil, and gas still serve about 80% of our energy needs. And we're actually paying the price. Using fossil fuels for energy has also exacted an enormous toll on humanity and the environment. And we all see that. And the next speaker will actually talk more about this after me. And all of these warming of our temperature and the climate crisis are all impacting human health and our well-being in a lot of ways. There are actually two categories of the impacts of climate change on health. We call them direct health impacts and indirect health impacts. So direct health impacts are usually those that um, you directly experience after a climate change related event, such as an extreme weather event like a heat wave or frequent and severe storms, flooding, droughts. They all contribute to direct health harms, whether injuries, whether fatalities, whether heat-related illnesses or cardiovascular failure. They're all um, called direct health impacts. But a large portion of indirect, a large portion of health impacts from climate change are actually indirectly caused by climate change. So that includes worsening health harms resulting from worsening of air pollution, which will be tackled by the next speaker, an increase in vector-borne diseases because the temperature is now more conducive for mosquitoes to breed, dengue mosquitoes to breed, increasing contaminated water in food. Um, Largely, we see this after flooding and storms that causes acute gastroenteritis, for example, or diarrhea. And then you have mental health impacts, of course. And we see psychological trauma, PTSD from a lot of climate disasters that we've seen in the past. And then also, of course, malnutrition, which is another important health impact that usually doesn't necessarily get connected to climate change, but it actually is very much interconnected with climate change. The way our food security is impacted by climate change also leads to impacts on nutrition, especially of children. Um, and then there's so many other things like respiratory allergies and asthma caused by, again, worsening air quality, among others. So there are also new diseases, infectious diseases, mainly from zoonotic diseases that we are seeing, and they're predicting to increase in frequency um, from now on because of the way the environment is changing. And COVID-19 is an example of that. It's like a precursor showing us what our future would look like if we continue to harm the environment the way the way animals and human interact with each other will also be affected. Um, and the most recent IPCC or Intergovernmental Panel on Climate Change report has shown this that there is a direct link between climate change and our health and well-being, particularly on heat-related illnesses, malnutrition, mental health, infectious diseases. And so there is no denying that this is happening. And that we also see that the impact of this to the future generations on our children and our children's children, their life will depend on how we address climate change today. And it is important to note that climate change is a global issue, but it is experienced very differently at the local level. Based on the most recent IPCC report, Asia is one of the most vulnerable to regions, if not the most vulnerable regions to climate change. And the key climate risks in Asia are urban infrastructure damage and impacts on human well-being and health due to flooding, biodiversity loss and habitat shifts that will also have disruptions that are dependent on human systems across freshwater, land, ocean ecosystems, etc. And then you have the decline in coastal fishery resources due to sea level rise. And then one more important thing is the risk to food and water security due to extreme temperature, rainfall, and drought. And in Southeast Asia, this is a quite an old map from 2009, but it's still very relevant. These are the most vulnerable countries in the Southeast Asia region to climate change, especially to 5 specific hazards: cyclones, floods, drought, landslides, and sea level rise. And we see the Philippines, where I'm from and where Vienna is from, is the most vulnerable to impacts of climate change. And these are just like um, snippets of news reports from recently and how Southeast Asia is experiencing impacts of climate change. So we know the climate crisis is a health crisis, and the most vulnerable, marginalized, and disempowered people are usually the one who are harmed first and worst. So this is a really big, major issue of equity and justice, especially children, elderly, women, and girls, people of color, indigenous peoples, those who are economically disadvantaged, and those living with disabilities. They're more vulnerable to impacts of climate change, especially health impacts. But then that's the one side of climate change and health. The other side of it is the health sector's impact to the climate crisis. And Healthcare Without Harm did a study in 2019 where we found out that 4.4% of net global emissions actually come from the health sector. And if it were a country, we would be the 5th largest polluter on the planet. Right now, actually, this data has been updated and it has increased from 4.4% in 2014. It's now 5.2% in 2019. So it's increasing. And so the health sector, and not just hospitals, the entire health sector, including pharmaceuticals, have the responsibility to reduce their environmental footprint so that we do not continuously harm the environment and our patients. And we found that 84% of the health sector's emissions actually come from burning of fossil fuels. That's why we really advocate for clean, sustainable, just transition to energy, renewable energy across healthcare delivery. And this is just an example. And this is the greenhouse gas emission or carbon footprint of 2 hospitals in Indonesia. And you can see that the majority of their emissions come from purchase of electricity. And that's just one component of hospital emissions that use fossil fuels. And some of it also are from fossil fuels, like employee commuting. The way your employees go to your hospital is also contributing to greenhouse gas emissions. So I just wanted to show that as an example that this is the reality on the ground, that hospitals actually are contributing to this crisis. And so when we talk about first do no harm, which is the Hippocratic Oath of health professionals, this for us extends beyond doing no harm to our patients. It's also doing no harm to our environment, because the way we treat and protect our environment has an impact on our patients, as we see. I'm not going to go through this I'm just going to briefly mention that we have seen that it will increase and increase even more the carbon footprint of the health sector. And of course, we are working and we're advocating for the health sector to also work on its carbon footprint and greenhouse gas emissions. And there are a couple of ways that the health sector can do this. We actually propose 7 high impact actions, and one of them is transitioning to clean, 100% clean and renewable energy, investing in sustainably grown food, etc. So these are all available on our website. And just to give you an update, a lot of countries have already committed to develop low carbon, sustainable, and climate resilient healthcare systems, because we see this is as an important component of climate action in the country. But of course, we cannot do it alone. The health sector can reduce its emissions, but it has to be a whole of society approach. And in Asia, there's a lot already that have committed and are actually doing action on this. And aside from our work with health systems and national governments, we also work with health professionals and climate advocates around the region and in Asia to work on ensuring that we protect not only our people's health, but also the environment. And I'm actually going to end my slide here with a quote from Dr. Tedros that this is something I really appreciate from WHO, stand on making sure that fossil fuel industry and our dependence on it ends soon, because it's an act of self-sabotage from the health perspective. I'm sorry for exceeding my time limit, Piana, but thank you so much again for inviting Healthcare Without Harm Southeast Asia.
Yeah. Thank you so much, Chit. It was very difficult to compress that everything in just a few minutes. So we're very thankful. More and more people are joining us in the room. And if you've just joined us, we're talking about the correlation between health and climate. And Chit just gave us a very comprehensive overview of that topic. So if you have questions for Chit, put it in the chat box. She can reply to your questions, or we can address that later in the Q&A. But for now, I'd like to bring on Sunil for so we already talked about climate and health, but right now we dive into the direct impact of the climate, health, and energy nexus, which is air pollution. So Sunil will be talking to us about how fossil fuels has been affecting the quality of air, especially here in our region in Asia. So Sunil, take it away. Thank you.
Thanks, Biana. Thank you for having us here to talk about the air pollution and health impacts of the fossil fuel industry in the region. And I'm very happy, and I'll try to because of the fact that Jeet went before me and she broadly spoke about most of the other kind of impacts arising out of fossil fuel industry, of which air pollution was a subset. She really made it easy for me to take slightly lesser time than I was thinking earlier. So I'll go back to Jeet's point, wherein she mentioned that the rising temperatures because of the fossil fuel consumption is resulting into different kind of direct and indirect impact, of which air pollution is just a fraction. And but this is a fraction which, apart from destruction caused by the extreme events, is another visible indicator wherein we see the consequences of fossil fuel usage in the near real time in form of air pollution related health impacts. That's not just one similarity between climate change impacts and air pollution impacts. The other similarity being that both of them arise from the mostly from the fossil fuel consumption across different sectors, ranging from oil, gas to coal-based industries and power generation sources. This is a map which kind of delineates the fossil fuel consumption versus general air pollution, wherein most of us know that about 99% of the geographies globally are living in areas polluted, more polluted than the WHO prescribed levels of 5 microgram for PM 2.5. So that map would have covered the entire region, but this is a nitrogen oxide map, and it basically, a nitrogen oxide basically is a resultant of fossil fuel consumption in the transport sector, industries, or power generation, and that's why we see high intensity in certain regions, whereas the other regions are relatively lower. All these regions with the high intensity are the fossil fuel consuming regions, either a big city which has huge petroleum product consumption in transportation sector, or these are industrial or power generation clusters where a lot of coal, oil, or gas is consumed. Yeah, so as I mentioned, I'll be mostly talking about the air pollution and health impacts and resultant economic impacts because of air pollution arising from the fossil fuel industry. So we at KRIA use a very simple methodology where we try to estimate emissions of different pollutants from different uses of fossil fuel across different sectors. And through that, we get resultant emissions, which are later on converted to health impacts and economic impacts. On the bottom of the slide, you also see that the same fossil fuels are resultant of greenhouse gases and climate change. This is a very simple pathway of how we anticipate and how anybody can kind of anticipate the health and economic impacts of air pollution. As I mentioned, we build an inventory to start with. Then whenever pollutants are released at one location, it's not just the vicinity of that particular facility which is impacted. The air pollution travels to hundreds of kilometers depending on the meteorology, wind direction, wind speed, temperatures, and rains, etc. So we model how far the pollution disperses from a facility, how many people live in that geography, which is experiencing the incremental air pollution levels, and then depending on the risk factors or dose response curve of different pollutants, we come up with health impacts, which are later on converted to economic impacts in form of loss of a working day, hospital visits, or money spent on specific treatments. Now, coming back to the correlation of air pollution and climate change, we recently did a study on Indonesia, wherein we kind of looked at Indonesia and its coal-based power generation fleet in different scenarios. Those scenarios being the presidential regulation 112 in 22 gave a pathway of renewable energy deployment as well as coal-based power generation for coming years till they achieve net zero. And then there are other scenarios made by us and our partners in Indonesia, where we looked at what would it look like if we have to abide by 1.5-degree scenario. So the graphs here, the lower snapshot of the pollution spread shows that in a 1.5-degree scenario, the pollution can be restricted to a very smaller region resulting into lower exposure or lower population being exposed to these high pollutions, which will ultimately result into a lower health impacts and the economic damage caused. And the right side graph shows that if we go by the plan the country has, there will be health impacts to the tune of 10,000 to 15,000 deaths per year till at least 2040, and after that it will start decreasing a little bit. Whereas if you follow a 1.5 degree scenario or a 1.5 degree scenario with air pollution control, the number of deaths or health impacts reduces significantly by 2035, moving to near zero. So that shows that it's not just beneficial to regulate fossil fuel consumption from a climate change perspective, but also from the health and air pollution perspective, which is again linked to economic well-being of the region. To account for how does or how much does the pollution from fossil fuels impact a particular country's GDP or economic growth, there is a study which we did in 2020 wherein we looked at the fossil fuel contribution to the GDP loss, economic loss, and we found that countries like China, India, Bangladesh in the region, as well as other countries across Europe, have a significant contribution or decrease in GDP to the tune of 4 to 6% of that country because of fossil fuel consumption across different sectors. The reports I'm not going to go into details of how much and how did we arrive at these numbers. The methodology and even more detailed explanations are available in the report, which are hyperlinked in the PPT as well. And it's not just that we look at a overarching country-wise scenario or a regional scenario or a global scenario. We at KRIA work very collaboratively with different regional partners, journalists across different regions, CSOs, researchers, and academia. And while we work on that, our focus till now has been looking at the health and economic impacts of fossil fuel-based projects. It can be a single project, it can be a combination of gas, coal, and oil projects across regions, or it can be a country's energy plan, which we assess. All those snapshots are just an example of our work in the Asian region or South Asia region, more prominently Southeast Asia. But this is also a snapshot of that, be it a coal mine or a coal-based power plant or a gas-based power plant, all of them result into some significant health impacts and the economic damage, and all that can be assessed. Most of we have already done studies for most of the regions, but if there is anything new which you might find interesting and want to work on, we are always happy to kind of look at new ways to kind of expose the fossil fuel industry's health, air pollution and health impacts, and we'll be happy to work on those kind of assessments. This is a slide. So when we talk about air pollution, it's invisible, and people don't die the moment they breathe polluted air, contrary to what happened during the COVID times. And that's why a lot of people and policymakers in the region don't really act or act efficiently to reduce air pollution level. But air pollution can be visualized using different models, different studies, and this is a visual representation of how pollution from certain power plants travel to hundreds of kilometers in the North Indian region on the left-hand side, and in the southwestern Pakistan and India on the right side. These plumes very clearly indicate that it's not just 10 or 20 kilometer geography around the coal-based power plants, which is impacted due to health impacts or air pollution levels from these polluting facilities. It's cities which are at hundreds of kilometers, which will also be impacted. Rural areas which doesn't have significant pollution sources itself, they will also be impacted because of the acts of the fossil fuel industry at a distant place. We at Korea have a lot of these kind of studies done on individual projects, countries' energy policies, or overall country scenario, as well as we kind of maintain databases on what is their equality level in a particular city on a given day in more or less real time. What are the ambient air quality standards of those regions, and how is the power generation or power demand of that region is being met in terms of what sources contribute to the overall electricity generation in the sources. So all that data in different dashboard format is available on our website, and these are just snapshots from it. And I've also pasted the link on the bottom of the slide. You can look at the products, and if you have any questions, please feel free to ask them now or send it to us later on. We'll be happy to answer those and maybe even work with some of you in future. Thank you. That's what I had in terms of presentation, but as I said, I'll be happy to talk in detail about the methodology or the data which I presented or is there on our website. Thank you.
Thank you so much, Sunil, for all those data that you presented. Definitely we'll have more questions for you later on our Q&A, but we've already talked about the human impact of the climate change and climate crisis that we're having right now. So we'd like to bring on the floor Leah Guerrero of Greenpeace Philippines to talk about why is this a climate justice issue as well. Leah, the floor is yours.
Thanks a lot, Vienna. Yeah, I'll just share my screen. So my whole presentation is basically about why climate crisis is a climate justice issue. Okay, just a second. Yeah, so this slide is just about Greenpeace, just to introduce it to people who might not be familiar with our organization. We're 23 years now in the Philippines and 52 years globally. We're an independent campaigning organization, and we do a lot of peaceful and creative action. And our core values are nonviolence. So even if we do creative actions, these are all nonviolent direct action, which is part of civil disobedience. We are politically and financially independent. We don't take money from governments or corporations, and that's why we could do things like the action that you see on the slide. Okay, so I just wanted to start with this slide. When I saw it, when AR6, IPCC, the Intergovernmental Panel on Climate Change, released its assessment report, sixth assessment report, the synthesis, they had this image, and it was very striking because you could see how the world will be very, very different regardless of whatever scenario you're looking at for people who are born now and people who will be born after 2020. I think that also kind of reflects how how we look at what their conditions are, because if you remember, like just last week or 2 weeks ago, there was this news about the start of the Anthropocene, and we're entering into a new geological era where they say that the old geological era was what enabled human life. So if we're entering into a new era that is unfriendly to human life, the conditions are not the conditions that gave forth to human beings, then that has a lot of implications on human wellness and health into the future. One of the main messages of the IPCC's synthesis report was that it's a critical decade for climate action. And I'm sure that everyone here knows that, but what exactly does that mean, right? And what options are open to us? For those of us, particularly who will be living into that future, which is not friendly to human existence. Okay. I'll just skip this slide. This was also from the IPCC report. And I just put this here because there was, if you look at this part of the slide, you'd see that there is very high confidence that the climate impacts of climate crisis that we're experiencing right now really has, they have, the IPCC has very high confidence that it will really impact human health. Okay. And behind this story about climate impacts and the climate crisis is another story, and that's a story of how this all happened, right? So we're looking at the climate crisis, how it's anthropogenic, right? And how fossil fuel companies, the burning of fossil fuels has actually really fueled this crisis that we're experiencing. So this slide is again, this image is from the Climate Accountability Institute. And it shows how just 20 companies, 20 fossil fuel and cement companies are responsible for 1/3 of global greenhouse gas emissions from fossil fuels and cement in 2018. And Climate Accountability Institute, they started accounting for the share of climate emissions of companies since 2013 when their first report was put out. And their very latest report puts this all into amounts. How much does it cost? How much damage did each company cost in the past several decades? Okay. So yeah, this has been discussed also by the first speaker from Healthcare Without Harm, how the climate crisis is actually a justice issue. And if you look at the big role of fossil fuel companies in the climate crisis, what we're saying, what a lot of organizations are saying, what communities are saying, is that they need to be held responsible for the harms brought on by climate impacts. So kind of segue very briefly to a case that we had in the Philippines here for climate impacted communities, as well as some NGOs, including Greenpeace, who wanted the Commission on Human Rights of the Philippines to look at the responsibility of these carbon majors, fossil fuel and cement companies, largely responsible for carbon emissions since the industrial age, and to look at how their businesses were impacting on the rights of Filipinos. So the report, the final report of the Commission on Human Rights was released last May 2022. And I just wanted to highlight just two findings, which is the first one here. Their contribution to climate change is quantifiable and substantial. And the last one, very, I think, well written, resonated with a lot of people who have been and organizations who have been really holding the movement for climate justice. So they said that the obstructionist efforts that these companies have been doing were not driven by ignorance, but by greed. I'll go to that later because I'm going to show a few slides which give that example. Anyway, these next two slides, I just wanted to highlight some community stories. When the way that we're talking about climate impacts right now, its impacts on health, etc., seems very scientific and everything. But at the core of it, it's a human story. It's about how people are actually experiencing the trauma, experiencing mental unwellness, okay, experiencing death in the family, lots of injuries and so forth. So I just wanted to show how the whole process of that litigation kind of brought this up. Okay. and also show how it also impacts its impacts on food security, for example, are also impacts on health, and so forth. Okay. One thing that case that was brought forward to the Commission on Human Rights, one thing that it did was it compiled a lot of information about the culpability of these companies. One of the kind of long discussions in it is how they knew that their businesses pose grave dangers to people and the planet and human health. So what I have here on the screen right now are snippets from the final report that we submitted as part of the petitioners for that case. And you can see that data documents, a lot of company documents show that the fossil fuel industry understood that climate change has significant impacts on human health, but they did not do anything to mitigate that, to stop their business or to change what they were doing. Okay, and here's another one from the 1990s. The companies were studying.
हेलो हाय अतुल जी,
yes,
सॉरी मैं एक वेबिनार में था तो इसलिए उस टाइम बाद में।
sorry.
मैं बढ़िया, आप कैसे हैं? हम्म
Oh, sorry about that. Go ahead. Go ahead, Lay.
Okay, yeah, sorry, because I can't see any faces while I'm presenting the screen. So I don't know what was happening. Sorry about that. So I just wanted to show more how this evidence was kind of compiled, and what fossil fuel companies knew was not just they were changing climatic systems in the planet, but they were also harming human health. Okay. But regardless, they still continue to expand operations, drilling for more oil, gas, and coal. And even in 2022, they broke a lot of record profits, even while communities continue to experience worsening climate impacts. So this is, I just put this here for emphasis. So the top, Exxon was the top earning fossil fuel company ever last year in 2022. They earned more historically than any other fossil fuel company. And this is, they had that historic high for profits at a time when the planet was already burning from the climate crisis. And at the time of their announcements, there was a study that showed how much money it was actually costing governments, how much money it was actually causing people just to cope with the impacts of climate crisis. Okay, but yeah, that's not all. It continues. It doesn't stop there. Because if you look at current plans of fossil fuel companies, they are expanding. There's this kind of really big projects called carbon bombs. I don't know if it was coined by The Guardian. But it's more than almost 200 projects that would create at least 1 billion tons of carbon emissions over 18 years. For the subsequent years. The money that they keep on putting into exploration, expansion, and further digging of fossil fuels is actually a very big amount, $103 million a day. And you contrast that with the situation that the world is facing. I'm sure that these companies, many of their employees likely are also experiencing heat waves right now in Europe and so forth. they're not immune to the impacts of the climate crisis, and yet they continue to do what they're doing. And even while, for example, a lot of the evidence and studies that we see, which were part of the body that was body of studies that was assessed by the IPCC, even if it really shows that the trajectory right now is really to make emissions peak and decrease it, aim for net zero. Even when that is the call from scientists, none of this is happening. Okay. So I just wanted to leave, this is not my last slide, but this is a very big question that, I want just to put in this discussion is, if that's how it's gonna look like, and we know right now what the health effects are already, right? Disease, death, vector-borne diseases, food scarcity that creates malnutrition and so forth. So how is it going to look like in the future when things are going to be a lot worse? Yeah. So what this tells us is that there's a really big injustice, right? So they're making gargantuan profits from something that is destroying the lives and health of people. Okay. And all these impacts can actually be traced directly to them. So they're knowingly profiting from all that injustice. So these are our calls for fossil fuel companies. They need to stop expansion and pay reparations to people that are suffering from climate impacts. I'll just skip this slide. So yeah, this is my last slide. Just to say that in order to secure the maybe one lens that governments can take if climate action is so hard for a lot of governments, one lens that they could take when looking at the climate crisis is really the health lens, and getting that impetus to secure the climate in order to secure public health. So part of that is recognizing the connection between environmental destruction and diseases, and not just diseases, but also the ability of the communities to cope with diseases. So if they don't have enough food, if the weather situation is not favorable, then they will be having to cope with a lot of diseases. And then the recognition that this is a public health issue as well as a climate justice issue. And then, so governments and communities should call for accountability and reparations from fossil fuel companies. And governments should be able to enforce solutions such as the energy transition and adaptation. And there's also, I guess, a lot of thinking, a very widely held opinion that the same actions that we do to stop the climate and environmental crises are the same ones that will also secure public health. So an energy transition, shifting to renewable energy will secure public health because, if we look at the discussions earlier on air pollution caused by the burning of fossil fuels and so forth, these shifts and these climate solutions will also lessen the risk of diseases. So yeah, I think that is my last slide. So I just made it very quick because I know we're out of time. So thank you very much.
Thank you so much, Leah, for those very insightful case studies that actually really brings human face to what we're trying to talk about right now. Definitely climate change is a human rights issue, and as you've said a while ago, but health and public health is actually a good entry point for climate action. And as you all know, there's gonna be an official health day at COP28 this year. But before that happened, actually, some of our fellows have already been writing about climate and health, and we want to bring now Hans and Nisha to share the experience on writing about in covering climate change and health. Hi, Hans. Hi, Nisha.
Hi, Vienna. Hi.
So you've heard our panelists, and I know that you actually already have been writing about the issues that they've talked about a while ago, and we've heard them that we've heard that this is really a really important topic. But in your perspective, how do you think, and how does covering climate, the nexus between climate change and health, and the impacts of fossil fuels can contribute to the broader conversation about climate action, and raising awareness and the urgency of these interconnected issues? What and But basically, like, why did you start writing about this nexus in the first place? Let's start with Nisha, who actually wrote about waste to energy, and also has been working on air pollution stories as well.
Hi, thanks, Vienna. So I will put my coverages that I wrote during my fellowship with Climate Tracker in the chat box. So I wrote a story about waste to energy, and so I think it's like what did mention in the beginning, that actually like plastic waste is also part of the problem of the fossil fuel. So like during like COVID and the pandemic, the use of single-use plastic in Thailand, and I believe in other countries as well, have risen up a lot. And so like in Thailand, so there are emerging projects involving with waste to energy, and we expected to have more than 70 projects now. And so during the fellowship at COP26, so I joined the panel like virtually, but it's a good opportunity actually that like I can manage my time and also like be able to reach out to the cases and the sources in Thailand. So I decided to cover about waste to energy because it's the what the communities are concerned here. And so I think it's writing about health and climate, it actually a very good opportunity for journalists to draw the issues closer to your audience, because you can connect it with the local context and the local environmental concern cases in your country. And it's also, you can tell the story of human, because then you talk about health, and it's a good opportunity for you to add the face to this abstract term. And actually, I believe that all of the journalists, when you cover about environmental stories, you already cover about health, but maybe you haven't highlighted it. So it's about like highlighting on this health issue.
Thank you, Nisha. During your time, Hans, you actually specifically wrote about fossil fuel and the impact of it to the health to public health. Why did you do that? Like, why is it important for your audience in Indonesia?
Yeah, sure. So maybe I'll start with my experience covering COP24 back in 2018 in Poland, Katowice. So at the time, if I'm not mistaken, the concept of One Planet, One Health wasn't hasn't started yet. So at the time, I wasn't really thinking of writing specifically about health issues related to climate change and fossil fuels. But because the COP that year was located in Katowice, which is the coal heartland of Poland, so it's a major coal producing region in Poland. I believe it's the largest coal producer in Poland, and because most of its population still use coal, still burn coal for heating, and at the time it was winter, so I realized that it was something that I had to write about. At least I mentioned in my story. So when I write about the story of COP24, I specifically choose the angle of the paradox of having COP in a city that is very, very polluted at a time, because the winter was quite harsh and because a lot of households they burn coal for heating. So it was quite easy to link those two together, to link the use of fossil fuel to the health impacts. So I remember writing something about breathing the air of Katowice during winter is the same as smoking more than 1,000 cigarettes in a year. So I think that's what is it, like a good way for me to engage my audience, to basically put into perspective the health impact of fossil fuel. So, like Nisha said, it is something that we can use to get the story of climate change, the story of fossil fuel, closer to our audience. Because if we're writing about all these fossil fuel companies, all these record profits, then the general audience, they might not relate to that. They see all these numbers and then they don't know how that these numbers affect their lives, right? But if we say, okay, these companies, they're profiting from, you know, our consumption of fossil fuel, they're benefiting from our reliance on fossil fuel, and then this is what this is the toll on our health, like this will reduce our life expectancy, etc. This might make it easier for them to really understand the gravity of the situation.
Yeah, both of you have highlighted that climate and health stories are everywhere. You just have to find it and just have to put a more effort to highlight why health is important and why it's interconnected to climate change. But how do you can you tell our audience, because they're also journalists, they also wanted to cover up COP, how do you explore potential stories about the intersection of climate change and health? Let's start with Hans.
Sure. I think you can start by talking to as many sources as possible. For me personally, I'd like to talk to scientists, read academic papers, because they contain a lot of information. There's a lot of story ideas that, for example, there's a lot of health impacts that I wasn't aware caused by climate change and fossil fuel, um, that I just found out from reading academic papers. And then maybe start by looking at your surrounding. Like me personally, I live in Jakarta, the capital of Indonesia, and it is very, very polluted at the moment. And maybe you can see, like for example, I noticed that the spatial planning of the city, the how the infrastructure is built is very, very much geared towards vehicles, private vehicles, cars, and motorcycles instead of public transportation. And then I remember reading something like, oh, that's because the car manufacturers are lobbying the government to actually maintain this kind of infrastructure, so that, you know, more and more people will keep buying cars. And then they will, you know, obviously they will consume gasoline, fossil fuels, and then that might in fact that might affect your mental health, because you're getting stuck in, you know, traffic jam for hours. So, you know, those kind of thinking, like looking at your personal life, like when you're stuck in the traffic jam, and then, oh, why do I have to, you know, to be here? Like, why can't I just, you know, take a train or something like that? And then from that, use your personal experience as, you know, story ideas, and then start talking to experts and scientists. Yeah.
How about you, Nisha? Can you actually take us to your thought process when you were writing your story during COP26? It was a very emotional story about the communities and their health risks in their fight for clean energy. Can you tell us more about it?
Yeah, on my side, actually, the protest about waste to energy project that was going to build in the south of Thailand was taking place just like, I believe, a week before the conference. But I think like people just like didn't see the connection between like this protest about like development project in their community with like the UN climate negotiation. So actually, so it's about like linking between what's going on at your hometown with this like global debate. And I think like there's potential to link it, and because like I think right now climate change is linked to every issues, but people tend to think that it's environmental concerns, but not related to climate change, but it actually is. But it's not, maybe not directly as like burning fossil fuel or reducing carbon emission, but it's more about like mitigation or adaptation as well. Like my story that I write about waste to energy. Waste to energy is usually considered as green project or climate solution, but then like you start asking questions about it, whether this solution can impact on the surrounding communities or not.
Thank you. I'd actually like to bring on our panelists from the earlier discussions to talk about this next question on how can we journalists and also organizations like Healthcare Without Harm, CREA, and Greenpeace can further amplify and collaborate and amplify the message on the health impacts of fossil fuels and climate change. Like, how do you think we can work together to put a spotlight on this issue? Let's start with Hans, I guess, and hopefully our panelists from earlier can join the discussion as well.
So if I understand the question correctly, how to collaborate more with CSOs so that we can bring this issue of health impact closer to the audience. Is that correct?
Yes, yes.
Yeah, I think from my personal experience, I think CSOs like Korea have been doing a really good job at reaching out to media. Like I've been getting a lot of press release, a lot of reports, direct email from all these NGOs. Uh, like I remember like Korea, they have been doing a lot of great job because I'm from Indonesia. So I think Indonesia is one of the what is it like the focus of Korea. So that's why I'm very familiar with their work. So yeah, and then they're also doing a great job in telling the findings of their analysis, which can be very technical, but telling it in a way that is easy to understand for journalists who might not be familiar with the topic, with all these technical terms like SO2, like PM 2.5. So I think if I mean going forward, I think one way to do it is to tell all these findings, scientific findings, analysis in a way that is more easy to understand, not only to audience but also to journalists, just to remember that not all of us are climate and yeah.
And I also like to ask on the CSO side, like, what do you think we can do as journalists to help you amplify this message? Maybe let's start with Jip.
Thank you, Benna. That's actually a really good question, and something that Healthcare Without Harm Southeast Asia in our work with health professionals have been wanting to do and something that we really try to make sure that we incorporate in our work is that health professionals in the health sector, if we advocate just within the four walls of the health sector, we will achieve something, but we will not go beyond that. So we definitely need to work and collaborate with other environmental groups, and of course the media, if we want to actually see change in society. And we have what we call RISE Alliance, RISE Southeast Asia Alliance for Health and Climate. It's a group of health professionals that are climate advocates, but also we did not limit it to just health professionals. We saw that we need to include other individuals who might not be health professionals but want to explore and work on the issues of health and climate so that we can see synergies, we can form collaborations, and the health professionals can lend solidarity to other campaigns that are already existing, like any coal fire power plant campaigns or fossil fuel campaigns that are already existing. How can health professionals bring in the health lens? Same with the media. How can we give you more information, health-related information that are based on science or provided by doctors? And as we know, doctors are one of the most trusted professions in the world. And so when people hear the advice of the doctor, they usually trust the doctors. And so when a news report or a blog is showing a doctor saying that, hey, this coal-fired power plant in Limay, Lanao, Bataan is actually causing respiratory illnesses to children and the elderly, people listen, and politicians and policymakers actually but hopefully listen to their advice as well. So I think that's my response to that question.
Yeah, I think there are so many research, or there are really like so much, as Hans a while ago said, so many academic papers about it. Korea has been doing a good work in researching what has been happening in the correlation of energy and clean air. But Sunil, I know I don't want to put you on the hot spot, but of course you can understand your graphs, you can understand your research, but how do you think we can actually, not to dumb it down, but to actually laymanize the research and for people to actually understand it, for them to be able to, you know, digest it and put it into like good use and learn why this is important work that you've been doing?
Thanks, Biana, for the question. And I think I'll start with where Hans was speaking that, and it was very encouraging to see that the kind of work we do is really appealing to journalists who can then later on speak about it, try to build a narrative, and that's when the policymakers and the general public kind of move. Now, coming back to your question, what's so TRIA exists because we want to play that role of breaking down the science in a common layman's language. And partly we do that by looking at the scientific data, facts, and even doing modeling exercises and putting the data out there in public domain so that people see it. And in most times we try to simplify the language in our reports itself. But at times, because we have to speak about certain terms and jargons which are used in the scientific community, so an approach which we at KRIA have developed across Asia, Europe, and every other region is that we always want to be an organization or a group of people who is very open to discussions with the journalists, other CSOs, and the policymakers. By that, saying that, what I mean is that we try to build these relationships with journalists, wherein somebody who's reporting on general environmental issues or biodiversity issue, for that person to understand air quality, climate change, SO2, NO2 is a bit complex. So we can get on the calls with these people. We can also try to summarize our report in smaller layman language paragraphs or summaries, and that's how we work. And I think that's a very critical space, as Jeet was also speaking, that when it doesn't really matter much when KRIA says something until unless people know or trust KRIA in terms of what they do. And that will only happen when the research we do goes out through media, through other CSOs, to the general public as well as to policymakers, and therein doctors, policymakers, prominent journalists, or even prominent media houses writing about the actual health impacts of research which we do really makes the difference. And that's where I think having the credible voices in the journalism space is something which Syria is always just sorry. There was a call. So that's where I think that's what Kriya believes in, and it's the power of collective who are doing different parts of the larger campaigning landscape, as people in Greenpeace and even others would know that it's not just data, it's not just activism, it's not just policy advocacy. Everything has to come together to make a serious change, and that's a part of that is simplifying research, and that's what we at Kriya are doing, and we are always happy and open to discuss more and talk about our research and also other data sets which are available, which might be difficult to understand for journalists. We'll be happy to speak on those.
Thanks, Sunil.
you.
So for everyone in our audience who'd like to speak with Sunil, he said he'll be available to talk to you about their data sets. But I just want to flag that we have so many good questions from our Q&A box that have been answered, thankfully, by Sunil and Jit. In the essence of time, I'm very sorry we won't be able to go to them one by one, but we'll be able to send to you the answers in our post-event email. But I also want to bring in Isha and Leah in these questions because in an hour that we've been discussing this issue, there's actually just one sentence and one topic that actually stood out, that climate change is actually a human rights issue. And if for us to be able to actually tell this story, it would be very important to put a human face into this urgent topic. So for the both of you, how do you think our journalists or our attendees can actually do that? Because let's start with Nisha, has been doing that for the past years, and maybe Leah can also add in and give some tips on how they were able in Greenpeace to find some case studies that will actually encapsulate what the topic is.
So I think I'll go ahead. I think there's many like environmental cases like in your home country, and you can start looking into that first. And I think climate change is a term and a factor that you can start, a question that you must ask every time you go into the field or explore to any case, because I think it's all relatable right now. So you start asking about this. Maybe it's not so direct and you have to need a little bit of observation and talk with people, but I think one way or another you can link the issue with the case, the on-ground cases. And I also want to say that it's good to like think beyond the boundary of your country and reach out to like CSO or sources. Maybe start from your region, because maybe some certain issues are still under study in your home country, like maybe the health impact of PM 2.5. This may be under study in your country, but then it might be well studied in other countries, and you can draw and give the examples from the researchers and study from other countries as well to like build the coverage that is concrete. So here is my answer.
Thank you, Nisha. Leah, anything you want to add?
Yeah, well, a lot of the speakers earlier already kind of expounded on how NGOs can collaborate with journalists. But maybe just one thing. In our work, when we work with communities, we do this a lot in our climate justice campaign, as well as in our cities campaign. We do a lot of storytelling sessions with communities and sectors. So it's sitting down with them and really trying to absorb their stories, just getting them to speak and not being the one to speak. So it's what happens is it's not about the issue. What we're sitting down about is not the issue, but the personal story of that the community that we're with, and it is from there that we get the richest material that we had from the court case, for example, from blogs, from these interactions. I feel that they're more powerful than just straight interviews and so forth. But there's another thing that I wanted to kind of put out in the open when we're talking about journalists and media and communities and justice issues, is one of the biggest challenges that we have as an NGO is when we kind of confront companies and those in power, right? It's very hard to give the counter narrative to what they're saying, and it's very hard to go beyond the story, the pronouncement, for example, or it's hard to go beyond the institution or the corporation. And that's one thing that we're trying to crack from our end. So that's a big challenge for NGOs, especially if you're going against big companies, mining companies, for example, fossil fuel companies, and there are communities who are powerless in the face of their power, right? How do we tell their story? And in a way that that is also acceptable to our editors. We once had a case when we were told directly by one of the editors that they couldn't publish one commentary that we sent in. So so just to put it on the open, that those are things that we face as we kind of delve into issues that are not contentious, but kind of go against prevailing narratives and prevailing figures of power. Yeah, thank you.
Thank you so much. We've gone so much over time, and thank you for everyone for staying. But finally, I just wanted to ask everyone. We know that COP28 is finally focusing on health on a certain day. What do you expect? What do you hope it will result in? What for you is a favorable outcome? Let's start with Jit.
Yeah, no, that's a very difficult. Is it a diplomatic answer that I need? um, yeah. Well, there are a couple of things that are happening on Health Day, and one of the things that we've heard is that there will be a high-level health ministerial meeting. So it's the first time that ministries of health are actually all being invited to be in a climate change conference, which is a big thing. Not all the ministries of health are incorporating climate change into their action plans. And I think this is an opportunity to further the fight against climate change and the causes of the drivers of climate change by providing that health perspective and that health lens through the ministries of health as well, and to also have the ministries of health of the region already think about how climate change will impact health systems, not only population health, but how existing health systems are not resilient enough to future impacts of climate change that would just exacerbate health inequalities in the community. So that's what I'm looking forward to. And yeah, I mean, we'll know more I think in the next coming months. There's also a lot of health events that are coming up now, side events mainly. That started back in COP26. So I'm looking forward to all of those as well, and to also amplifying the voice of Southeast Asians in the health community. I've only been to one COP, last year's COP, and I didn't see a lot of health professionals from Southeast Asia. And that's one thing that I do want to hopefully change through our work with the Rise Southeast Asia Alliance for Health and Climate is to bring in, if not physically, even just virtually have health professionals from Southeast Asia talking about their experience on air pollution, climate change, and health in the region. Thank you.
Thank you, Jit. And sorry for putting you on the spot, but I'll continue to do that for everyone. Sunil, any thoughts?
I won't take much time, but similar to everybody and adding on to what Jeet just mentioned, the hope is always to go a step beyond where we were last year, and I will definitely like to have integration of health from all angles into our climate communications. And secondly, maybe a little bit of seepage of the language on no new fossil fuels in terms of at least the countries which already have surplus electricity generation capacity, and most of them in South Asia who have already built a lot of fossil fuel capacity, and this is the case globally. So I would like to see a bit more stronger language on no new fossil fuels, or starting decline of the fossil fuel, or having a definite timeline at least. We know it's very hard to get, but the hope is to hear that someday. So thank you.
Thank you for that very hopeful message. Leia, are you also hopeful?
Yeah, we need to be hopeful. Yeah, hopefully. Maybe what could happen out of that meeting could be a statement that to secure health, we need to really phase out fossil fuels. But I'd also like to add one of our calls, which is money on the table for loss and damage, recognition that health is the loss of things that secure our health, a good environment, a healthy environment, the loss of that is actually something that qualifies as loss and damage, maybe, so that there will be money on the table for healthcare in impacted countries. That's not a loan, but compensation. Thank you.
Thank you, Leia. And for Hans and Nisha, are you looking forward to write anything about health this year? Hans?
Yeah, for sure. Again, from my personal experience, because the air pollution in my city has been worsening, so that's definitely something that I'm looking to explore more. Um, and in terms of what's going to happen at COP, I genuinely don't know, because COP can be very, very unpredictable. So it is not something that I usually do. But I'm hoping for any of these predictions to come true, especially the one about stronger words on phasing out fossil fuels, coal. Because I haven't seen any meaningful follow up on that pledge last year. So yeah.
And finally, Nisha, how do you think this will actually be very crucial for the communities you're covering?
Like throughout the year, I've been like asked by the CSO and some communities that like they really want to read the coverages about COP in their language, like in Thai, because I think mostly Thai people don't read English much. So I think like for all journalists, like it's very important to talk about this event like in your own language and in your own media landscape as well, because the people are, I think, maybe don't be afraid that people don't want to read about it, but actually people understand it more and really want to read them.
Thank you so much. That was a very nice way to end this conversation, to actually localize and hyper localize the topic so everyone will actually be interested in it. Thank you everyone for your questions, and for our esteemed panelists for their very insightful and inspiring answers. And this discussion has been long overdue, but I'm very thankful again for the 5 of you for staying with me. We're doing this webinar to invite everyone to join us in our coverage of COP28. So we're asking everyone to write a story on the health consequences of fossil fuels and the interconnection of fossil fuels and climate change. We will send links to your emails for you to be able to join and apply to our opportunities. Again, thank you so much for our panelists for joining us in this webinar, and have a good night, everyone. Thank you. Thank you.
Thank you.
Thanks a lot.
Thank you, everyone. Take care.